This video will summarize the article titled, Are Postnatal Traumatic Events an Underestimated Cause of Porencephalic Lesions in Dogs and Cats? Starting with the introduction, cerebral cystic lesions, ranging from extensive brain defects like hydranencephaly, where the neopallium almost disappears, to smaller focal lesions like porencephaly, have been identified in humans and animals. Porencephaly is often a solitary cavity filled with fluid and is regarded as a congenital developmental or an encephaloclastic disorder, caused by destructive processes like cerebral ischemia, trauma, or infection. The veterinary literature often considers hydranencephaly and porencephaly together as criteria for differentiation or subjective. Some retrospective papers and case reports have recently been published on MRI, diagnosed canine and feline porencephaly. Traumatic brain injuries resulting in focal brain tissue loss and cavities filled with cerebrospinal fluid are known as ex vacuo lesions and share the same imaging features as genuine congenital lesions. The author's hypothesis in this retrospective study is that symptoms of canine or feline porencephaly might result from traumatic events in the first weeks or months of life that are more widespread than usually believed. The goals of the study were to explore a broad cohort of dogs and cats with MRI-identified porencephaly, identify MRI features useful to differentiate congenital from traumatic cases, and define the prevalence of seizure activities. For methods, this is a descriptive retrospective case series that conducted a search in the medical record databases of 2 referral veterinary hospitals between February 2007 and January 2023. The cases included dogs and cats with a cerebral cavitary lesion diagnosed by MRI. The search used terms such as cysts, cavitary lesions, ex vacuo lesions, porencephaly, and hydranencephaly. To qualify for inclusion, the cases had to have a complete signalment and a reviewable MRI of the brain. Medical records were reviewed for information on neuroanatomic localization and neurological signs obtained from history and neurological examination conducted by an ECVN board-certified neurologist or an ECVN neurology resident, when available. The MRI studies were carried out using either a 0.22 Tesla or a 1.5 Tesla MRI under general anesthesia. All MRI studies were independently reviewed by a European College of Veterinary Diagnostic Imaging board-certified radiologist, an American College of Veterinary Radiology board-certified radiologist, 2 neurology interns, and a European College of Veterinary Neurology board-certified neurologist. Using a digital imaging and communications in medicine viewer program, all cases were classified as affected by porencephalic cavities, PCs, when a presumed CSF-filled cystic cavity was present in the wall of a cerebral hemisphere and surrounded at least partially by brain parenchyma. Hydranencephaly, identified by loss of brain parenchyma for an extension of at least 2 lobes associated with a partial loss in other lobes for an entire hemisphere or both hemispheres, was excluded from the study. MRI images were assessed for PC number, lateralization, lobar involvement, communication with CSF spaces, involvement of white matter, gray matter, or both, and contrast enhancement. The presence of concomitant musculoskeletal abnormalities and further concomitant parenchymal abnormalities, as well as additional diagnostic tests such as CSF examination, if performed, were recorded. Descriptive statistics were carried out using Microsoft Excel. Going through the results after the initial search in medical records, only 32 out of 38 patients were considered porencephalic, while the others were excluded due to being classified as hydranencephalic or exhibiting evidence of other accompanying disorders. Among the porencephalic cases, 23 were dogs and 9 were cats, with mixed breeds being the most common dog breed. Neuroanatomical localization was available for 28 out of 32 cases, and most showed a forebrain localization, although peripheral vestibular and T3, L3 spinal cord segment localizations were observed. More than half of the patients had both seizure activity and other neurological deficits, and the mean age of seizure onset was 26.1 months. CSF was collected in 11 cases and found within the normal range, except in 1 dog that showed an albuminocytological dissociation. MRI scans were conducted on all patients, with 21 cases being examined with a low-field MR scanner and 11 with a high-field MR scanner. A total of 39 PCs were observed, with 25 cases showing a single PC and 7 cases showing 2 PCs. In most cases, the PCs communicated with both the ventricular system and the subarachnoid space. The parietal lobe was the most affected, with most defects involving both gray matter and white matter. 5 cases showed contrast enhancement, and 20 cases showed musculoskeletal changes. 14 of these cases exhibited fractures that were closely related to the PCs and were considered the presumed acquired traumatic forms, with 7 cases having a history of head trauma in the first weeks or months of life. In conclusion, 32 porencephalic cases were identified, predominantly in dogs and with mixed breeds being the most common dog breed. Most PCs showed communication with the ventricular system and the subarachnoid space, with the parietal lobe being the most affected. Musculoskeletal changes were observed in 20 cases, with 14 cases exhibiting fractures and thinning, or depression of the calvarium overlying the PC. The presumed acquired traumatic forms were linked to a history of head trauma in the first few months of life. Meningocele or meningoencephalocele was seen in 4 cases located at the level of the parietal lobe. CSF was collected in 11 cases, and the mean age of seizure onset was 26.1 months. For the discussion, this study presents an overview of porencephaly, a cavitary lesion with smooth, well-defined borders that is frequently described in small animal medicine alongside hydranencephaly. Hydranencephaly is a condition involving the severe loss of brain parenchyma, often resulting in a total inability to develop the cerebral hemisphere. The occurrence of porencephaly, in contrast, is more closely associated with focal injury, such as a vascular accident or trauma, leading to the complete loss of a part of the cerebral hemisphere during the perinatal period. This study focuses on porencephaly in a larger population of dogs and cats, with a particular emphasis on the rare condition's clinical and pathological features. Many of the patients were less than 2 years old at the time of diagnosis, with 28.1% being cats. Porencephaly should be regarded as a differential diagnosis for young cats with neurological signs, especially when there is a history of seizure activity. Likewise, almost 22% of the patients in this study were at least 6 years old at the time of their diagnosis. This suggests that regardless of whether porencephaly has congenital or acquired origins, the related clinical signs may appear late in life, indicating that porencephaly may be an incidental finding. The predominant clinical manifestation observed was epileptic seizures, appearing in 71.8% of the recorded patients, especially in those aged between 21 and 72 months. However, almost 1/3 of epileptic patients had a normal neurological examination. Hence, an MRI of the brain is essential, even in patients with normal neurological examination, for which the first differential diagnosis is idiopathic epilepsy. Additionally, 14 patients out of this population of dogs and cats had MRI abnormalities suggestive of skull fractures. From these, half had a history of severe head trauma between the 3rd week and 5th month of life. A potential hindrance to complete verification is the low resolution of many MRIs. Furthermore, other limitations include a lack of histopathological confirmation in all cases and the lack of proton density weighted sequences, the most useful sequences for detecting traumatic bone lesions. Regardless of these limitations, this study suggests that traumatic events may be more frequent in the occurrence of porencephaly than often reported. To conclude, this study provides insight into porencephaly in dogs and cats, highlighting its rarity as well as its elusive characteristics. The study's primary focus is on establishing possible underlying causes and tracing the clinical history of affected patients. MRI scanning is, therefore, a critical tool for identifying neurological and musculoskeletal abnormalities that assist in revealing a traumatic etiology for porencephaly allegedly caused by postnatal traumas. This study redefines porencephaly as a condition that may have implications beyond seizure activity in young cats.